Hi everyone, in this video we are going to cover analysis of variance test, also known as ANOVA. ANOVA test has three different types, one-way ANOVA, two-way ANOVA, and repeated measure ANOVA, and we are going to learn how to use the first one in SPSS program. The two-way ANOVA used when we have two categorical independent variable and one scale continuous dependent variable. It tests the significance of mean difference between the groups. For example, difference in mean of weight in Saudis according to gender and diet type. Repeated measure ANOVA used when we compare the mean difference of sample in three or more different setting or timing. It's similar to paired t-test, but in this one we have three or more points as a reference. For example, difference in mean score of exams in different blocks during the first year in medicine. Please notice it's the same group of students. The third one, it's one-way ANOVA, used when we have one categorical independent variable with three or more subcategories and one scale continuous dependent variable. It tests the significance of mean difference between the groups. For example, the relationship between gestational age as a category and birth weight. We have our null hypothesis. There is no significance of mean difference of birth weight in grams according to gestational age category, and the hypothesis will be there is significance of mean difference of birth weight in grams according to gestational age category. Now let's go to SPSS. This is the gestational age category we are going to use. It has five subcategories: preterm, early term, full term, late term, and post term. To use the one-way ANOVA, we go to Analyze, Compare Mean, and one-way ANOVA. In the dependent list, we are going to put our weight as a scale. And in the factor, we're going to put our independent factor, which is the gestational age as a category. Now we go to Options. We take the descriptive, homogeneity of the variance, and Welsh, and we will know why. Continue, then OK. We will end up with four tables. The first one is descriptive. It has the number of each subgroup, the mean, and their standard deviation, minimum, maximum, and the confidence interval, and so on. Please notice in the standard deviation we have quite different numbers between the subgroups, and this will reflect directly on the variance, which will be widely variable as well. The second table, it's related to the homogeneity of the variances. As we watched in the t-test and explained in the t-test video, that the Levine test we will determine which table we are going to use, either ANOVA or Welsh. The significance of Levine test is 0.00, which is less than 0.05. In this case, we have to reject our null hypothesis and accept the hypothesis. The hypothesis of the variances state that there is no difference in variances between the subgroups, but we have to reject it as we have different variances among the subgroups. And as I mentioned previously, the standard deviation is different, so it makes sense that the variance will be different as well. So as we rejected the null hypothesis, we have to go to the Welsh table instead of the ANOVA. Here we have the significance of 0.00, which is also less than 0.05, and this means there is different in the means between the subgroups, but we don't know the direction or which subgroups are different. So in here we have to go and do the multiple comparison analysis. I will explain it in a bit. For the multiple comparison analysis or post hoc testing, we have first to calculate how many variables we will end up with. So in here we have our variables were 5, which is preterm, early term, full term, late term, and post term. So we have 5. Then we will fill the equation and we will end up with 10 different variables. Here we can see them all, the 10 of them. Notice that we don't have to report them all. You have to report which is related to your study or aim of the study. Previously we see that our testing is not equal variances, so equal variances are not assumed in our case, so we are going to use the post hoc testing. It's Games-Howell instead of Bonferroni if we equal variances assumed. Now we go back to the SPSS. We go to Analyze, Compare Mean, one-way ANOVA, and in the post hoc we're going to check Games-Howell, and we go back here for options and take the mean plot, and this will give us a visual viewing of the data. Press OK. Similar, we have our descriptive, homogeneity, ANOVA, and Welsh from our previous running of the process. Now we will have our table of multiple comparison. Here we have each of our subgroups and it's assigned to the other 4 groups, and we can see the mean difference and the significance of each one of them and the confidence interval, lower bound and upper bound. It's repeated, so when we have the same result repeated twice, one in the early term, one in the preterm. For example, here we have preterm and early term and preterm. This one will be in negative and this one will be in positive. So which one we're going to report? It's depending on the aim of the study. So if we are assuming that the preterm has less weight than the early term, so we are going to use the one in minus. But if we are assuming in our paper that the early term has more weight, we're going to assume more weight instead. As we can see here, we have 4 groups that are not significant, which is early and post, full and post, late and post, and full and late. Those 4 are not significant. And further visualize the data, we can see the means plots in here. So as I mentioned, we have 4 groups that are not significant, where 3 of them are related to post-term. That post-term and late term is not significant, post-term and full term are not significant, and post-term and early term are not significant. And as we can visualize here, the difference is less than 200 or 250 gram, so it makes sense, while the preterm and the other groups has huge difference in mean. Like in here we have our preterm mean around 250 gram and the early term it's less than 300. So the significance in mean difference in those groups are higher. And this will conclude our video for today. Thank you everyone.